Hello everyone, and I am happy to have with me Dr. Ayush Megotia. He's a proud Damsonian and he's secured a very good rank of 219 in NEET PG 2019. And not to forget that this is a rank amongst 1.5 lakh people, yes, right? So it is an amazing achievement and very well done. How do you feel,
Ma'am, it hasn't sunk in just yet, and I'm feeling on the top of the world right now.
I can understand that. I can understand the emotions behind it because it requires a lot of hard work and dedication to reach here. Ayush has been a foundation and a TND student with us, right? Ayush, I think let's start with, how did you start your journey for NEET, and what all do you think you did right to reach where you have reached?
So basically, I joined DAMS foundation batch in my third year. So along with that, I also joined TND in my internship year. The idea was, as my seniors also said, the notes are more than sufficient. So I tried to do the notes. After I completed my notes, then I tried to give the subject-wise test.
Okay.
And then because the main preparation was during the internship years, so I was giving the subject-wise test and also giving the test and I was also a student of test and discussion.
Right. So online test as well as the course classroom.
So the thing was, you get used to all the questions from all the exams. Basically, you don't have to do book of any particular like AIMS or other exams. So basically the idea was very simple, but unfortunately I couldn't crack the NEET in my first attempt.
What was your rank, if I can ask, if you don't mind?
No ma'am, in my first attempt my rank was around 3500.
Okay.
So it was a bit hard for me because I always wanted medicine.
Okay.
And being a graduate of MAMC, I always wanted medicine in Delhi. So I dropped in the year 2018.
Okay.
And the thing was, initially I went haywire a little because I wasn't confident on myself. And some of my seniors said that you might try doing subject-wise guidebook. I did that for the initial 2 to 3 months.
Okay.
But the thing is, like I can give you the example of surgery. The regular notes of surgery aren't very extensive. But the thing is, and you might feel inclined to doing the guidebooks. But the thing is, by the end of the year, when you have done your TND and you have got the notes of TND and you have also attended the DVT, there isn't anything left which you should be doing. So the idea is very simple. You have extensive material everywhere, but the thing is, if I can give you my example, ज़्यादा इधर उधर नहीं देखना है. Stick to the basics and trust your notes. You can add it if you get the point somewhere else, but let the core notes be of DAMS. And
see, because Ayush, the thing is that there's a lot of material. Anyways, medical science is very extensive.
Yes,
but the idea is you have to know what you need to crack the entrance exams. Right? So you have to focus on making things concise. Do you agree on that?
Yes, ma'am, surely, ma'am, and that's why I wanted to share my experience of what I did wrong more than what I did right. See, the right thing is what every faculty tells you and what everyone will tell you, but I wanted to share my experience of what I did wrong and what I could have avoided had I not done those guidebooks, of which answer you're not even sure of.
Right.
So,
and they take a lot of time as well.
Yes. So, yes, ma'am.
Yes. So, yes, he wanted to ensure that he gives this out, and
Yes, ma'am.
because he's learnt it the hard way, and you want things to be put it in the right form across, right? So, Ayush, can you tell me that you were basically relying on notes, and that is what you were revising, and when you were giving the tests, what was your strategy for the tests?
Ma'am, initially I wasn't able to complete the test in the given time frame.
Okay.
So the initial idea was to try to complete those 300 questions in 3 hours or 3.5 hours, whatever there is.
Yes.
After I was confident that I could go through all the questions in 3.5 hours, then the idea was to analyze. See, the thing was, I was doing my notes, and even after that, when I was giving my test, I was making silly mistakes.
Right.
So I tried to analyze, why did I make mistake? Was it out of the syllabus, or
that's very important?
Or was I not able to remember, or was I thinking stupidly in the exam?
So basically, you assessed your paper very well,
Yes,
and
ma'am.
you find out why you were doing a particular thing wrong.
Yes, ma'am.
Okay.
And the thing was, initially, I was kind of scared when I used to see some question of more than 3 to 4 lines. But when you give grand test, you get so used to it that your tachycardia will reduce when you find the real questions in your NEET exams,
Yes.
or for that matter, any exam.
And do you think that the grand test, the papers that we make, quite reflect the real exam?
Ma'am, if I can say, some of the questions seems they have directly been taken from the grand test. So you get the actual idea, and the thing is, I also gave CBTs. So you have to go to the center and give the exam, so you get a real time feel. So you are not lagging behind in any way. And नए क्वेश्चन को देख के जो डर लगता है, that goes away when you give the grand test.
Right.
So that is very helpful. Many of my seniors used to say, just read notes, go through the notes. I did this in my internship here, but the thing was, I was not practicing any questions. And that's why I think I lagged behind. But this time I ensured that.
You worked on your weaknesses.
Yeah, I worked on it, and here I am happy.
Yes, that's very important, and I think that's very important. We have to learn that if we have to improve from where we are, we surely have to work on our weak zones, right? And Ayush, क्योंकि course बहुत vast है, how did you plan your revisions for it?
See, the thing is, like for extensive subject like pathology, I used to make the notes of DAMS notes.
Okay.
See, if there is 15 important points in one page,
Right.
So I used to write it somewhere else. I used to make my own notes from the
Okay.
DAMS notes.
Okay.
And ultimately the thing was, after I had made the notes of all the pathology, there were some 20 pages or 15 pages in which I had concised everything.
Okay.
The things which I couldn't remember, or
Yes,
which
so
I was...
it was according to you, things that are volatile
Yes,
for
ma'am.
you, things that you are weak in. So you used, you
Yes.
channelized it, and you reduced your work with every
Yes, ma'am.
reading.
And after the grand test or subject wise test, if any mistake I used to make, I used to add it
Okay.
in my own notes.
Okay.
So the revision was very simplified for me.
Okay.
And
this way, Ayush, if I may ask you, did it reduce the time you took for the revisions?
yes, ma'am, I used to complete the whole 19 subjects revision in around 22 days.
Okay.
So that was advantage for me, because I could do
Multiple revisions.
more number of
Yes,
revisions.
that's right.
And this is...
So I think you basically understood that there's no point collecting new stuff. It has to be making it concise and redoing it over and over again.
Ma'am, the thing is, if you can remember all the DAMS notes on your fingers, even that is hard. And if you can do it, that is more than enough.
Right.
Because there is no limit to what you can collect.
That's so true.
Because there is no demarcation कि क्या PG के लिए क्या MBBS के लिए.
Bilkul, that's right.
So the thing you have in hand, at least you try to master that and try not to make mistakes from those questions at least in the
That's
exam,
very right.
that's more than enough to get selected and to get a decent rank.
That's right. Okay. And Ayush, हमें ये बताओ that the exam has visual questions as well. So was the DVT good for you to overcome those visual questions?
Not only DVT, in the test and discussion itself, in the paper, many image-based questions
Yes.
were there. So
That's right.
I think I benefited more from the TND. I cannot thank enough. And I had attended the TND of both years in 2017 and 18 as well.
Right.
So that has helped me vastly. And in the DVT, of course, we get everything, every image-based illustration, or for that matter, video, or
Yes.
any procedure is there. So the thing is, you are not left behind in any way
Yes.
if you can just go through the notes you already have.
Right.
Yeah.
And Ayush, close to the exam, there's a lot of stress as well, right? And you have to overcome that stress, and you have to do revisions as well. So close to the exam, आपने क्या किया था?
Ma'am, I wasn't stressful at all because it wasn't going to help me in any way. I had some group of friends which were
Okay.
very cool. We used to discuss the stuff we used to read throughout the day at night.
Okay.
So there's no point in it, and because you are trusting your notes. So ultimately, when I appeared in my exam, तो एग्जाम देने से पहले ही मुझे पता था कि 300 में से 200 क्वेश्चन तो पक्का देखे हुए आएंगे.
Okay.
It could have been wrong, but I was confident when I
And
sat
did
in
it
the
happen?
exam.
Did it happen like that?
Ma'am, I think I scored 872, so ma'am, definitely it happened more. It was more than 200 questions.
Yes.
So yeah, and whatever marks I lost because of my silly mistakes, not because some new question came or
Right. Right. And any piece of advice that you would want to give to people who are starting this year and probably, maybe starting at the same level with not such a good rank, but they have to restart and, with the same zeal and do well in the exam?
The thing is, the coaching material can provide you all the stuff, but that doesn't ensure that you will clear the rank, because there are many students who are doing only the coaching material and yet they are not cracking the exam. So the thing is, ultimately it is you who have to study, and the thing is, you just need one genuine attempt to clear the exam. So don't think about the consequence, क्या होगा क्या नहीं होगा, पढ़ लो बस. And मतलब, although many faculty is saying this year's exam was more logical and tougher as compared to the last year, but I found it very easy, although I gave the last year's exam
As well. You've given
as well.
both years' exams.
Yes, ma'am.
Right. Perfect. And do you think that whatever we are doing at DAMS is sort of more than enough to get a good rank in the NEET exam?
Ma'am, the thing is, even on DAMS, there is plenty of material. Like I also used to go through eMedico's question
Right.
and videos.
Yes, we've given previous year questions as well with the answers. And
Yes, ma'am. So the videos basically they are clinical kind of videos. So that helps to a large extent in exams like AIMS
yes.
and JIPMER, to say that. So I think in your free time, if you can get time, please, if you can go through that, it would only add to your knowledge.
Yes.
And I surely have benefited from all these materials.
That's great. And any just last motivational line for your juniors?
Just don't think about the result, be it your first attempt, second attempt. Try to read and read again and again, and don't look here and there. Like my friends used to do individual coaching classes of various subjects, but because I had trust that last year I had secured around 3000 rank, and only due to the lack of revision I had lagged behind. So I didn't do much thing else, and I just revised, and I think that should do the trick for you.
Great. Right. So I think if I just say that, his idea is that, which is actually true, that instead of collecting more and more stuff, you have to have faith in what you have. You do multiple revisions and practice questions and keep yourself focused and motivated.
Yes, ma'am.
Right. Thank you, Ayush, for all the valuable information and things that you've provided for your juniors, and I'm sure they'll benefit from it. And I thank you very much for being here, and we wish you all the very best for your future from everyone here at DAMS. Thank you.
Thank you. Sure.
Thank you.
And surely I have to thank Deepti ma'am for the Ops and Gynae notes. I have reminded her multiple times.
Yes,
but
you have.
Ops and Gynae, your first year PG के लिए भी it is more than enough, those notes. So yes ma'am, thank you for everything.
Thank you so much. That is really overwhelming. Thank you so much.